Welcome back to Africa Science Focus, the weekly science and development show from SciDevNet. I'm Ogechi Ikeanyao. In this episode, we spotlight a remarkable collaboration between the University of Zambia and the Hokkaido University in Japan. Together, they've developed a new rapid diagnostic kit with the potential to change the way Ebola virus is managed in the African region. Between 2014 and 2016, there was an outbreak of Ebola in West Africa. First dictated in Guinea, it quickly spread to the neighboring countries of Sierra Leone and Liberia and reached other countries, including those on the European and American continents. Over the course of the outbreak, the World Health Organization reported that more than 28,000 people were infected and over 11,000 people died. To understand the significance of this innovation, let's first take a brief journey into the history of the Ebola virus. Ebola, a highly contagious and often deadly virus, has been a persistent threat to countries in Africa. Outbreaks dating back to the virus's discovery near the Ebola River in Democratic Republic of Congo in 1976 have posed serious health challenges. Ebola is a form of hemorrhagic fever. It causes flu-like symptoms including fever, fatigue, and muscle pains. These are followed by vomiting, diarrhea, rash, and internal and external bleeding. According to the World Health Organization and the African Centers for Disease Control and Prevention, the Ebola virus has been responsible for devastating outbreaks, causing significant loss of life and economic disruption. One of the critical factors in managing Ebola outbreaks is early and accurate diagnosis. In past outbreaks, timely identification of cases proved challenging and led to increased transmission and difficulty in containing the virus. According to the World Health Organization, during the West African Ebola outbreak in 2014, delayed diagnosis contributed to the rapid spread of the virus across multiple countries. The collaboration between researchers at the University of Zambia and the School of Veterinary Medicine and their counterparts at the Center for Zoonosis Control, Hokkaido University, Japan, has seen the development of a new tool for testing Ebola virus known as QuickNavi. This test is deliberately simple to use and can test for Ebola in as little as 10 minutes. Dr. Katendi Changula spearheaded the creation of this kit. She's a senior lecturer and researcher at the Department of Paraclinical Studies, School of Veterinary Medicine at the University of Zambia. She spoke to us about why quick and accessible tests like this are so important.
One of the things that had been happening in the majority of Ebola virus outbreaks is that months would go by before it is actually diagnosed as Ebola, because one thing that you need to know is that Ebola comes with symptoms of normal tropical diseases like malaria-like symptoms, yellow fever-like symptoms. So these are diseases that are found in within Africa. So people would be treated for these other diseases without them knowing that it's actually Ebola. So what this kit does is it helps to reduce the time between the initial outbreak or the first person and the confirmation to say this is actually Ebola. And because of that, it actually reduces the number of people who get into touch with that person and then the number of people who then subsequently get infected. So basically, it limits the outbreak. And that is the biggest thing that we want to take away from with this test, is that we need to limit the outbreaks. And limiting outbreaks means early detection. Early detection means that simple test that is rapid and easily deployable in the field, easily used in the field. And that is what this test is.
QuickNavi promises faster and more accurate results and could be a potential game changer in managing outbreaks of Ebola virus disease. So how was this kit developed? Dr. Katendi tells us.
This idea started in 2010. I conceived this idea, and then together with our colleagues from the Hokkaido University, then I was able to put the idea into fruition. In 2010, I got a scholarship for PhD on the organization called SACIDS that was funded by the Wellcome Trust. And in that, there were several themes under that program. And then I chose the theme of development of tests for filoviruses. So then I had a mentor who is Professor Justin Masumo from UPN University in Kinshasa, DRC. And he suggested that we make a rapid test for filovirus diagnosis. So when I say filovirus, that's the family that the Ebola virus belongs to, Marburg virus belongs to. So that was basically where the idea started. But then how to go about it, that was where the problem was, because we didn't have the facilities, the technology, the know-how about how to go about it. But we did realize that it was important to have a rapid test. So that is how my supervisor at that time, who was also the dean of the School of Veterinary Medicine, Professor Mwene, reached out to Professor Takada from the International Institute for Zoonosis Control in Hokkaido University, Japan. And that's where the collaboration began.
The kit is very easy to use. Dr. Katendi tells us why this is so and explains the process of using the kit.
Ebola was a disease of third world nations, and even in those third world nations, it was not a disease of the city. It was a disease of the remote areas in the forest. So really, nobody paid much attention to making a test like the one that we made. And one of the effects of there being a lack of field adapted tests was that because the outbreaks were starting in remote areas that were very, very far away from any lab with sophisticated equipment, because previously you had to have sophisticated equipment to do the diagnosis of Ebola. And so because of that, the outbreak would start and a lot of people would die because people would be getting infected. And it is only when you started getting healthcare workers getting sick that people would then think about and say, what are we looking at? Could it be Ebola? Because then you have healthcare workers, doctors, nurses, people in the clinics getting sick and dying. And then that is when attention would be paid to the disease. And it would take even up to 3 to 4 months from the initial outbreak to the point where the disease is then finally diagnosed as Ebola. That is how long it would take. Even the West African outbreak took several months before it was actually diagnosed as Ebola, because it started in the remote regions, but it kept on amplifying until it went into the cities. So the reason why we made the test was we wanted to make sure that even in the remote areas where there is no electricity, there is no sophisticated laboratory equipment, even sophisticated know-how on how to run the equipment, you can have a simple test that any simple clinician can use and be able to detect the disease and to stop transmission at that point, to reduce further transmission and to limit the outbreak to just the first few cases.
So how do health workers use this kit? And what training do they need when working with such a dangerous disease?
The kit comes with a self-explanatory labeling and packaging on how to use the kit. But of course, even the initial time when we went to DRC and we worked with the individuals who are involved in testing for Ebola virus, we're able to then show them how the kit is used. But it's so the biggest thing about this Ebola testing kit is not about the use of the kit, but it is about how the people using the kit can protect themselves from infection. So it's basically because it's a level 4 pathogen, so you have to handle it with care. That is why the healthcare workers that use the kit already know how to protect themselves, how to use the basic PPE and the PPE measures. So the use of the kit itself is not complicated. So as long as the anybody who has worked in the lab and reads the packaging is able to do the test.
Dr. Joseph Ndebe works at the School of Veterinary Services in the Disease Control Department at the University of Zambia. He sheds light on some of the challenges with the rapid diagnostic kit when deployed in the Democratic Republic of Congo.
Anybody can, of course, the kit is easy. You can use it within 10 minutes. It's user-friendly and things like that. But because of the nature of the virus that is able to detect, we need skilled personnel. That's one limitation. Then two, you can't buy this kit and take it at your place. In case there's a problem there, then you do it yourself. Because of the nature of the virus, you may be just able to spread the virus to other people. So that's the reason. Those are some of the limitations that are there. Because despite this kit being user friendly, you can only use it in controlled environment, which in this case is hospitals and things like that. So that's the major limitation of this kit. It's user friendly, but you can't do it at home. You have to do it in a controlled environment.
Dr. Joseph spoke to us about accessibility of the kit for African countries who require it.
From my view, I don't think there are any logistical challenges. All that we may need is platform like your case, like the one that you've given to us, where we can roll out this idea to other countries where they're able to know that there's actually something like this that is actually working well and it will actually help. And in terms of the company that is producing this kit, according to the information that we have at hand, they are ready to produce as many as you can, depending on the need and the quantity that people want. But for now, what we wanted is that people first should know that there is this kit that people can actually use. And if the emergencies, that's why you've seen even where there are emergencies, we don't go there to go and sell this kit. We just go and donate for the purpose of people knowing that this kit is there and is able to help in that regard. The plans is that this kit has not been developed to Zambia alone, but it has been developed for the world. So meaning, if we are able to use it, Congo is able to use it, meaning the whole Africa and the entire world at large are free to use it. So all that we need is platform like your case, where we'll be able now to share this information with people, to say there is this kit around which can be useful. Not all which can be useful in terms of diagnostic of Ebola elsewhere. And that information, if it's out there, then maybe we may talk about logistical challenges and things like that. But as it stands, we don't have any of those. And the plans of rolling it out, we want everyone else affected by Ebola to have this kit so that they'll be able to make quick decisions based on the result that will be getting from the kit.
Professor Ayato Takada is in the Division of Global Epidemiology at the International Institute for Zoonosis Control, Hokkaido University in Japan. He was part of the Japanese team that helped develop the kit. He talked to us about how the kits were developed.
The our antigen detection kit does not require the electricity and does not require any particular specific equipment. And that kit is very stable, and it can be stored ideally in the refrigerator, and for that can be used at least 1 or 2 years in the refrigerator. And if we think about the situation of the Ebola outbreaks, it occurs in the remote area, but usually that doesn't have any advanced laboratory. So in that kind of area, the clinical person, and my doctor or nurse, anyway, they can just collect blood and then drop one drop onto the kit, and then they can diagnose. And that I think that is that is one of the advantage of our kit, that is an antigen detection kit. So that is very friendly to African situation, I think.
Another limitation of the Quick Navi detection kit is that it cannot detect the Sudan Ebola virus. Professor Ayato tells us why this is so.
In that member of Ebola virus, there are some different viruses. The Ebola virus, that is a prototype of that in that member, that is basically they produce they produce the outbreaks many times in the past. Ebola virus, the prototype. So we called that previously Zaire Ebola virus. But in that Ebola virus group, there are some other viruses: Sudan virus, Bundibujoga virus, Thai forest virus, and Riston virus. All these are known to cause hemorrhagic fever in humans or in human primates. And these viruses are actually very different. We call that antigenically different. That means some antibodies to Ebola virus cannot react to Sudan virus. So in that kit, we used some antibodies that is specific to Ebola virus and Bundibujo virus and the Thai forest virus, but not Sudan. So we have to change the antibodies used in the kit to detect Sudan virus. But already we produced such kit, and we can produce the kit. But they recently used the Quick Navi, the prototype, the first one is Ebola, Ebola, the Bundibujo, the Thai forest specific. So we have to improve the kit to detect all these viruses. Actually, it was already done, but it's just the test stage. The previous one, prototype, has been approved by Japanese government already, but the second improved one has to be tested in clinical setting. For example, during the outbreak of Sudan virus.
Ebola antibodies are an essential part of these test kits, and Dr. Katendi Changula developed the antibodies required for the kit to be accurate. She tells us the process of producing these antibodies.
So basically, I'm sure we all know what antibodies are. When the body gets infected by any foreign organism, then the body is going to produce a response to that foreign organism. And what you normally get as a response to that organism is what we call polyclonal antibodies. So the antibodies are effective against a lot of different parts or segments of that virus or bacteria or something. But to make a test like this, we need to be very sure of the type of antibodies, that they had to be very specific. So these are what are called monoclonal antibodies that are only specific for a specific area of the virus. So that when you want to produce a test, you know that it is always going to pick up the virus because of that specific part of the virus that it is identifying. So what the process was to make monoclonal antibodies. And how is that done? The first thing that we had to do was actually make a virus make a virus particle that simulates the Ebola virus, but is not infectious. So basically, maybe I could say like an outer casing or outer shell of the virus that is actually, or looks like authentic virus, but cannot produce itself, so cannot infect. So that when we made what are called virus-like particles, that is involving 3 of the 7 genes of the Ebola virus. And that basically created a shell of the virus that made it look like it was an authentic virus, injected that into mice, and then the mice responded. The mice responded by making many different antibodies, so the polyclonal antibodies. So there was to many different parts of that virus-like particle. And then what we had to do then now was to actually get the antibodies from the mice. And antibodies, we use the spleen of the mice because we have a lot of the B cells in the spleen. Those are the ones that produce the antibodies. And we basically cultured those cells and extracted like one, how can I put it, like one cell in one well. So like we tried to get an individual cell. Sometimes we couldn't, sometimes we could, but you dilute it in such a way that you're only getting one cell, so that one cell is only producing one type of antibody. Because what we didn't want was the polyclonal, we wanted the monoclonal, a specific one. So we got, I think in that we had 127 different cells producing different antibodies. And then from those 127 cells, we then had to see which antibodies could pick up the virus infection better. So we then had to do several tests to say which antibody has a stronger response to the virus, like particle, the one that we created. So from that 127, we narrowed it down to 10 different antibodies that were picking up strongly the Ebola virus, as well as other filoviruses that also, other Ebola viruses that have caused disease in humans. Because we don't only have one specific type of Ebola virus that causes disease in humans, we have several. So what we wanted was to have something that was cross-reactive so that as long as it's an Ebola virus, it should pick. So from those 10 that we had narrowed it down to, with the help of the company that produced the test, that is the commercial, the company is called Denka, then we're able to then narrow down to 2 that were very, very strong. And then those 2 are the ones that were used in the test. So to actually pick up the virus-like particle. And then following that, we then, because remember, we were not using actual real virus, we were using a pseudovirus or a shell, let me say like a shell of the virus. So obviously we had to then see if it worked with the actual virus, and that is how we were able to collaborate with our colleagues in the Democratic Republic of Congo, who have had several Ebola virus outbreaks, and they have Ebola virus positive samples, and we're able to then go and test in the DRC, as well as doing some other laboratory tests in some in the lab that also cultivates the live virus. So basically, that was the process.
Dr. Katendi also shared the challenges she faced while producing the antibodies for the kit.
Even just the process of making the monoclonal antibodies takes a long time. It took us about 5 months to actually produce the monoclonal antibodies before we could even start thinking of sending them to Denka company for the actual production of the physical test. So, and after that, of course, we had to do multiple tests. At some point, when we made the first prototype was made, it didn't work very efficiently. It was able to detect, but it was not detecting so well. And the biggest challenge really was that at that time, because I remember I started this process in 2010, and at that time, not many people knew about Ebola. It was not a disease that people would then say that we really need a test for Ebola, because it was a disease of poor nations in remote regions. Nobody really cared. But then what happened to actually accelerate the test was that there was the outbreak of Ebola in West Africa in 2014. I'm sure you are aware of that. I think that is when the majority of the world got to know about Ebola. Because at that time, the device had even been put on the shelf because it was not working efficiently. The company that was producing it really was concentrating on other things that were commercially viable. So when the outbreak occurred, they basically remembered that we have this product, and went back to it and were able to refine it in such a way that it was then working better than it had been before. And that is why then in I think that was 2015, that's when we went to DRC to test with the actual samples that had been that the DRC had from previous outbreaks. So it's not been a smooth process, really. It's been a process of a long work. It takes long to do, and then it got interrupted, and then was resumed. And finally, we have a product that is in use, that is available for use.
Dr. Sheila Makiala uses the Quick Navi Ebola detection kit in the field. She works at the National Institute of Biomedical Research at the University Clinics of Kinshasa in the Democratic Republic of Congo, and she speaks to us about how the tests are used in the Democratic Republic of Congo, a country where there are frequent Ebola outbreaks.
Quick Navy is a rapid diagnosis test that we use in the field as a first screening test to rule out Ebola infection before confirming the diagnosis with a PCR test. So this gives us a quick idea on which sample might be positive or negative on with a PCR. And then the information will be used to rapidly start with a case management intervention in the Ebola treatment center, such as isolating patients in triage units to avoid subsequent contamination while waiting for PCR results. And also, there is another benefit for mainly lab workers. Knowing that one sample is positive or negative for lab workers can reduce a little bit the stress of handling such dangerous samples in the lab.
She also recounts her experience using the test during an Ebola outbreak in the Democratic Republic of Congo and the impact the kit had in managing the cases.
The first time was in Bikoro. In Bikoro, as you know, PCR tests is not easy to deploy in the field because of all logistic problem that we have in our countries. And when we arrived in the field during the outbreak in Bikoro in 2018, we didn't have any other diagnosis tool to confirm the diagnosis of Ebola in the field during the outbreak. So we started using Quick Navy. And at that time, I can say that we had a very good result because we considered actually those results to start with the case management implementation. And then after that, when we were able to deploy the PCR test, then we confirmed the diagnosis with PCR. I think that we had actually at that time 100% of sensitivity. Yes, after confirmation with PCR. So we have a good experience on using Quick Navy tests in the field, actually. Apart from deploying the kit during outbreaks, we deployed also the Quick Navy kit in regions with high risk of Ebola outbreaks for preparedness. So the kit is, used also for preparedness in the country.
That's all from us at Africa Science Focus today. If you want to find out more, head to the SciDevNet website. That's www.scidev.net. Today's show was produced by Alice Hurst with editing and reporting by Ogechi Ekeanyanwu and Titilope Fadare. I'm Ogechi Ekeanyanwu. Until next time, it's goodbye. This project was funded by the European Journalism Centre through the Solutions Journalism Accelerator. The fund is supported by the Bill and Melinda Gates Foundation. Do you have any comments, questions, or feedback about our podcast episodes? Let us know at podcast@scidev.net. Africa Science Focus is produced by SciDevNet and distributed in association with your local radio station.